Thank you, Mr. Chairman, and thank you all for being here today. When I speak to people in my district, whether they're community health centers and clinics, physicians and nurses, hospital associations, or patient groups, I hear by and large that we must focus on increasing access to critical services like treatment centers, not decreasing those services and incentives. The Affordable Care Act massively expanded mental health and substance use disorder benefits and federal parity protections for 62 million Americans, and the arguments we heard yesterday from the Trump administration pose an imminent threat to the well-being of America. I would like to first focus on how the ACA is helping to address the drug overdose epidemic, which claimed over 70,000 lives in 2017, with opioids accounting for nearly 48,000 of those deaths. In California, buprenorphine is growing in popularity due to regulatory changes, physician training, and other initiatives. The rate of Medi-Cal enrollees, California's Medicaid program, who received buprenorphine nearly quadrupled from the end of 2014 to the third quarter of 2018. The counties that make up my district are part of 40 California counties taking part in the Drug Medi-Cal ODS, Organized Delivery System, pilot program, and have joined California's effort to expand, improve, and reorganize treatment of SUDs in Medi-Cal under California's Medicaid Section 1115 waiver. In that vein, Mr. Isasi, what tools has the ACA provided to help us fight the opioid epidemic?
So this really cannot be stated strongly enough. The number one tool in this country to combat the opioid epidemic is the Medicaid expansion, period. I've worked with governors all over this country who are trying to stop this terrible plague in this country. Governor Beshear from Kentucky could speak so eloquently. Kentucky is one of the worst hit states in this country, and it was the Medicaid expansion that helped him save lives. It provides the medication people need, and it provides the therapy that they need to be able to deal with the addiction.
Anyone else want to add to that?
I would add to that. I think before the ACA, 45% of individual plans did not cover substance use disorder treatment. With respect to the opioid crisis, you need treatment both before and after. So you need insurance access. You need to have coverage to cover you for your pain treatment. That is not necessarily a pill, but let's say is a behavioral therapy treatment. And you need that insurance coverage on the back end if you are addicted. There's nothing more important to combating the opioid crisis than getting more Americans covered.
Absolutely, and this is something that we hear we need additional attention to and additional resources for, not the opposite. So let's focus on Medicaid for a moment. The ACA's Medicaid expansion has reduced the unmet need for substance abuse treatment by, according to some estimates, as much as 18%. Professor Gluck, you noted in your written statement that Medicaid is the largest payer for addiction treatment in this country. And in fact, you both have said that. And according to the Kaiser Family Foundation, Medicaid provides comprehensive coverage to nearly 4 in 10 non-elderly adults dealing with opioid addiction. So Professor Gluck, if the ACA is overturned, what would happen to people who have gained access to treatment through the Medicaid expansion?
Well, they would lose it, and the crisis that we're dealing with now and trying to solve would get even worse.
It's that simple. There's no plan to...
I have not been made aware of a plan, and I would say that the administration's own plans to combat the crisis depend on that insurance coverage being in place.
Right. There are other aspects of the ACA that have facilitated expanded access to treatment. In your written statement, you mentioned the importance of providing tax subsidies to help people purchase insurance through the marketplace. The ACA also expanded parity for mental health and substance use disorder coverage, meaning insurance plans are now required to cover these services just as they cover medical and surgical benefits. How would eliminating these provisions undermine the gains we've seen in connecting people with substance use treatment?
Well, these people who now have access to mental health and substance use disorder treatment would lose it. You would go back to a time in which they were out there by themselves, maybe relying on pills and not getting the kind of healthy treatment that we need to combat the crisis.
Do you believe that insurance companies without the ACA would cover these kinds of things, these kinds of services?
Federal law requires mental health parity, but we know that mental health parity provisions have not been adequately enforced, and in fact, there are different ways to get this kind of treatment. And so you don't want insurers just covering a cheap pill. You want insurers covering the panoply of services that get people off pills and get the kind of pain and mental health treatment that they need. They need deeper insurance coverage to accomplish that.
Right. We've received a statement for the record from Pennsylvania Insurance Commissioner Jessica Altman crediting the Affordable Care Act's protection for pre-existing conditions and expanded coverage of mental health and substance use disorders for helping the state fight the opioid epidemic. She wrote that overturning the ACA would, and I quote, effectively undo a decade of progress made towards ensuring those with mental health and substance use disorders have access to crucial, effective, evidence-based treatment services. I would like to enter Commissioner Altman's statement into the record. We are truly facing the worst public health crisis in a generation, and yet this administration is doing everything in its power to take health insurance coverage away from those who need it most. If the president truly wants to tackle the opioid epidemic, it starts with protecting and expanding rather than taking away health care for the millions of Americans battling substance use disorders. And with that, I yield back my time. Thank you.